The one thing that applies to everybody, from an infant to an athlete to a geriatric patient, is this idea that aging is a disease. It's not a natural thing. I know a lot of people will argue with me on this point. So red light therapy acts on metabolic health, cellular metabolism, and weight loss through exactly the same pathway. And this is kind of true of all of the benefits of red light therapy. It basically enhances mitochondrial function. Every cell in our body is powered by the mitochondria, which produce energy. Energy is our currency. It's how we pay for anything within the body. So anything that has an improvement in the energy levels within the cell starts to see dramatic benefits. The basic process is very complex, but the idea is all cells improve because the mitochondria of all of your cells improve.
Using something like the red light therapy can really help in your normal practice, where you normally work on mechanics and to get function and movement going. The red light can further reduce inflammation and pain, which can help in overall management of patients.
We get so caught up in the busyness of our lives, wearing many hats, that we often take care of ourselves last. So for my clients, restoring balance from the inside out really means finding the body's natural rhythm again. So red light therapy, for me, the impact that it has start with booking your first appointment.
So I'm Keith Dudgeon, born and raised in Johannesburg, professional cricketer of 12 years now. Through the 12 years, I actually haven't suffered an injury of any sort of magnitude, and then went down with a full ACL rupture in a warm-up of the second game when I was playing in England. I think the biggest scare that I got was sitting down with the professionals, and they say the word a year, which was quite frightening, obviously, in my profession. So 9 months to a year with an ACL was sort of the time frame they gave me. And I needed to do something about that, needing to be on the park within 6 to 7 months. I was obviously introduced to red light, and I'm back playing, so it sort of speaks for itself.
I mean, when we're looking at athletes, and I've got guys like Keith who play both local and international cricket, we have to be very careful with what we're using because they are tested for any banned substances. And one of the most potent things you can do for recovery for an athlete is red light therapy. There's no endogenous hormones, there's no peptides, there's nothing that's banned by WADA, and we're seeing phenomenal results.
I struggled the most when my knee was swollen, and that was the more swollen, the more pain there was. After the red light sessions, I definitely felt like the pain was way down, and then obviously allowed me to get, if not into 2 sessions a day, the next day I was able to train at full intensity, which then sped up my recovery time.
I want to give an athlete an extra 10 years of competitive lifespan because we're learning so much that we can optimize.
MedWave red light therapy actually complements sports injury treatments and recovery, and also for our patients that train for major events. It's got added benefit of quicker recovering because of the anti-inflammatory response they get, the work on the mitochondria where the ATP increase, so the recovery is quicker, and also the mobility is better.
I started training outdoors for the Ironman, of course, and then I broke my radial right wrist and hurt my elbow as well. So I had to recover from that. I couldn't train the intensity I was training. I couldn't walk some days. Then I had to skip 2 or 3 days, then fall back into training. It was on and off, and I couldn't train as much and hard as I would have trained. And then Dr. Herman told me about the MedWave.
You must just remember the red light therapy is an added benefit. It doesn't replace anything else, but combining it together, you just get a better result and a quicker result. And I think these days, in our day we live, your sportsmen want a quicker result and a quicker recovery because there's a lot of pressure on them to perform, and there's a lot of more races and events on. And I think that's an added benefit to the whole recovery process.
I would recommend it for anybody that's got an injury or must recover quicker. It can be dancing, it can be anything, or elderly people that's got problems with maybe a hip or a knee or whatever. Most definitely I will start my journey with a MedWave.
I personally think that inflammation is the cornerstone of aging. And if you can address inflammation, you address aging in a very meaningful way. So when we're looking at optimizing these things through red light therapy and seeing inflammatory conditions coming down, I mean, obviously we're going to age better. So if we can classify that and say we're all on the spectrum of age and decrepitation, how do we slow that disease process from while we're young and putting good habits in place to we're already old? How do we turn back time and get back our youth?
I've gone through 3 operations on my back, which didn't really help. So I must say I will not subscribe to another operation. I'd rather go and try to use light treatment or physical manipulation to improve my condition, or at least maintain it.
So with regards to Mr. Novak, we've been seeing him for a couple of years here. He first presented to us with peripheral neuropathy. He has got burning sensation chronically every night, especially in his feet and lower legs. And he also had a few operations, spinal operations, because he also had a pinched nerve in his L4-5 vertebra. The plan with him using the therapy, the red light especially, is to really maintain symptoms and to help him with pain.
I can say that the sciatic nerve has definitely improved, and I was in pain when I was walking and also when I was lying down and sleeping. This has improved to the extent that I can sleep the night through, and I think that is an improvement.
Hopefully the red light can even stimulate a little bit of nerve healing in his legs. And what we want to do is we want to keep his pain levels as good as possible, his mobility as good as possible, and him as active as we can.
I started researching red light therapy. I had this dream of adding it to a wellness center because I'm a nutritionist. And so the research led me to red light therapy. And because of the healing parts of it, inflammation reduction, but then just months later, I was diagnosed with RA. And I didn't know at the time how much, well, I'm going to need red light therapy myself.
The stories that have impacted me the most would be my autoimmune clients. I've got a handful that I've had the pleasure of meeting with and treating. Jessica Ryan is one of them. She's got rheumatoid arthritis, and it was quite amazing to see that the light could affect the body so quickly and move inflammation out of the body so quickly. She sat with me for 10 minutes after her first session, and her skin was twitching, everything was moving. So to see the visual was quite amazing. And then having her come back for repeat sessions and just watch her every time she walked in here, a little bit more of a step when she was walking, a bit of a bigger smile, feeling better. And I think it was after the 6th session, I messaged her and asked how she's feeling. And she just replied with, "Thank you for giving me my life back."
Having your life back, having energy, not being nauseous all the time and in bed all the time, it is like miraculous, it's marvelous.
With regards to chronic pain management, the red light therapy can be very beneficial to stop the pain cycle. Neurologically, it resets the system. It can also help with actually reducing the inflammation that the person gets chronically.
My backup was in 2020, right?
2020.
Yeah. So I've been for physio every 6 to 8 weeks. It was part of the requirement. And often I'd feel worse after physio. I'm not knocking physio, it just didn't help for the lower back pain part. And so I was really, really surprised by week 3 when I actually felt it was just as if some of the tightness was just letting go. And by week 4, it was gone. I was like, fine.
My name is Astrid Schwartz. I am 40 years old and I am a South African powerlifter. The current challenges that I'm facing as an athlete with strains like on my body have been mainly inflammation in my right shoulder and a slight QL strain. The MedWave therapy has really made an impact on my recovery since I started using it. After my sessions, I've felt a lot more relaxed. I've been able to calm down, which has really helped me sleep better at night and also feel a lot less stressed, which is also a factor in our recovery.
We've got Astrid Schwartz, the world champion powerlifter, that comes to see us for recovery sessions. That's been really great to see how it calms her, regulates the nervous system, assists with her recovery sessions. Sleep is such a big part of our recovery just for the next day. So to give that back to someone with a light is incredible.
What I've noticed, especially when I have had changes in my program where you're more prone to novelty soreness when the program changes, I found that after using the therapy, my soreness hasn't lasted as long as it normally would, and that is always a bonus because we're always trying to recover as quick as we can before the next session.
The patient's feedback have been very, very good with regards to pain and recovery. I would definitely recommend this to any practice.
If you're really suffering enough, my opinion is you'll pull out all the stops and go and figure out what might be worth it. And I'd put this on top of the list.
To give someone back quality of life is phenomenal without having to take anything extra or add anything extra. I think it's wonderful.
I'm so grateful that I was exposed to this technology, and it's made me better than I was before my injury. I can sit twice a week, get onto the red light, and my recovery time is halved.